It's recording.
Hi, I'm Dr. Ed Jacobs, and this is Dr. Tori Stone. And we're talking about one aspect of impact therapy. In the model of impact therapy, we talk about rapport, then contract, then focus, and funnel. What this segment is about is the contract. And Tori, what are your thoughts on the contract? And then
I think it's one of the most important things that we do in counseling. I think it's overlooked in a lot of training programs and in a lot of the counseling that we do. A contract is establishing what are we working on today. What I say to clients a lot is, if I helped you today, what would that look like? And that's a way for me to check in that we're working on the right area, and for the client to redirect me if necessary.
well, yeah, and the contract, always the student or the counselor needs to know where he or she is going. And the contract for me does that. And I know I have a CD on this about how it can change. But otherwise, I feel like the student just meanders around, and it sort of ties into that concept of the depth chart. If you don't have a contract, you don't take the session very deep.
Right, and I think what we see with a lot of novice counselors is that they do a lot of following of the client. So the client's talking about this, I'll follow that. The client's talking about this, I'll follow that, which keeps the counseling from being as effective as it could be. Whereas if you establish a clear, mutually agreed upon contract, this is what we're working on today, and then the client starts to meander in a non-productive way, I like to check in and say, okay, we were talking about blah, that was our agreed upon contract. Do you want to change the contract and talk about X? Or do we need to come back into focus? And that's, to me, a kind of a non-confrontational way to say, this is what you're paying me for, is to get help on this issue. Let's stay with this issue.
There's another concept in contract is, like you said, agreed upon. But sometimes with me, there's times where there's an implied contract when the teenage girl has the alcoholic boyfriend, that is abusing her, and she wants to get close to him still. I'm thinking, in my mind, the contract is to help her to see a way out. So sometimes it's not always, would you see that? That it's not always mutually agreed. But boy, it's so important that the counselor be clear what the contract is, and then if it changes, it can change.
And we liken it to going to a doctor's office. You don't walk into a doctor's office and say, when they say, what brings you in, you don't say, hey, whatever you want to do to me today. I think we're professionals, and it's important to recognize that we are being paid specifically to deliver a service. And working with a contract in the same way that you would in any other professional relationship helps to make sure that you and your client have the same goal in mind in each individual session, or at different parts of each session.
And for more information about impact therapy or the contract part, please go to my website, impacttherapy.com.